Are you taking vitamins every day, but your legs are still weak and you still get cramps at night? If so, you are not alone. Many people over 60 still maintain the habit of taking vitamins in the hope of maintaining health or boosting immunity. But few people know that each type of vitamin has its own specific role, especially for muscles, nerves, and leg strength. So it's very likely that you are lacking some important vitamins, and even if it's just a slight deficiency, it can be enough to make you prone to leg fatigue, muscle weakness, nighttime cramps, or even loss of balance. One of the leading causes of falls in seniors. The issue is not that you are not taking vitamins, but rather that you might be taking the wrong type. So in today's video, we will help you explore the top 10 vitamins and minerals specifically for foot health, scientifically proven to enhance muscle strength, prevent cramps, and improve mobility in seniors. If you want to live actively independently and no longer be bothered by cramps every night, then this is where you should start. And before we dive into the main content, please hit the like button, subscribe to the channel, and turn on the notification bell so you don't miss any important shares about senior health from us. Let's start with a vitamin that most seniors are deficient in, which is vitamin D. Not only is vitamin D the sunshine vitamin that supports the immune system, but it is also a vital factor in maintaining muscle strength, protecting the skeletal system, and preventing cramps, especially important for seniors. But why is vitamin D often deficient in people over 60? There is a solid basis for this. After the age of 60, many seniors start to spend less time in the sun, absorb less through the skin and intestines, or are taking medications that hinder the metabolism of vitamin D. Additionally, seniors often tend to accumulate excess fat, and since vitamin D is a fat-soluble vitamin, this causes a large amount of vitamin D to be trapped in fat tissue, preventing it from functioning effectively in the body. That's why many people still experience muscle weakness and cramps despite trying to eat well and take multivitamins regularly. What's concerning is that a lack of vitamin D not only causes a dull ache in the calves, but also reduces the number and size of type 2 muscle fibers, the type of muscle responsible for quick reflexes and strength when you stand up, climb stairs, or regain balance if you stumble. Lacking this type of muscle, your legs not only become weaker, but also react more slowly, increasing the risk of falls, fractures, and loss of independence. However, the good news is that vitamin D can repair those damages. When supplemented correctly, vitamin D helps increase the absorption of calcium, magnesium, and phosphorus, essential minerals for muscle contraction and relaxation processes and preventing cramps. It also activates VDR receptors located within muscle cells, promoting muscle protein synthesis and aiding in muscle recovery after the exercise or injury. As a result, you will feel your legs stronger, more flexible, and less prone to sudden cramps at night. Clinical studies on seniors have demonstrated that supplementing with 800 to 2,000 IU of vitamin D daily helps improve leg strength, increase walking speed, and significantly reduce the risk of falls, especially in those who already have low blood vitamin D levels. So how can we effectively supplement vitamin D? First of all, make sure you get at least 800 to 1,000 IU per day if you are over 60 years old. It can go up to 2,000 IU if you are at risk of deficiency. Rich sources of vitamin D include salmon, sardines, egg yolks, milk, and fortified cereals. You can also sunbathe in the early morning for about 10-20 minutes a day to support natural synthesis through the skin. However, it is important that you have regular blood tests. A 25-OHD test will accurately indicate whether you are deficient or sufficient, allowing for the adjustment of a safe and effective supplementation dose. To optimize effectiveness, there is an important tip you shouldn't overlook. When supplementing with vitamin D, make sure to also supplement with calcium and magnesium, because vitamin D helps absorb these minerals. But if your body is deficient in calcium or magnesium, the effectiveness in protecting bones and preventing cramps will not be maximized. In summary, vitamin D is not just a vitamin good for bones. For seniors, this is the silent guardian of leg strength. Properly supplementing vitamin D not only helps reduce cramps, increase muscle strength, and alleviate joint pain, but also helps you maintain mobility, live independently, and walk confidently every day. Don't let this silent deficiency rob you of your freedom. Start paying attention to vitamin D, because healthy legs are the foundation of a healthy life. Next, vitamin C is often underestimated as just a cold remedy or immune booster. However, what many seniors do not know is that vitamin C plays an essential role in maintaining muscle strength, protecting muscle and joint tissues, indirectly reducing aches and pains, and preventing cramps in those over 60 years old. Notably, the risk of vitamin C deficiency in seniors is quite common. For several reasons, a diet low in fresh fruits and vegetables reduced absorption capacity due to age or gastrointestinal, digestive, or diabetic conditions. Those who consume alcohol are at even higher risk due to factors that increase the excretion and rapid depletion of vitamin C. So what benefits has vitamin C been proven to provide for the legs? Research at the University of East Anglia, UK shows that people with high levels of vitamin C in their blood tend to have greater muscle mass, more flexible muscles, and a significantly reduced risk of cramps and leg pain. In sports studies, vitamin C also helps reduce muscle soreness after exercise, increases recovery ability, and lowers the risk of muscle cramps due to electrolyte deficiency. The reason for these benefits lies in the way vitamin C acts in the body. First of all, it is a powerful antioxidant that neutralizes free radicals and reduces inflammation in muscle tissues damaged by aging or intense exercise. More importantly, vitamin C is essential for the production of collagen, the main component of tendons, ligaments, joint cartilage, bone membranes, and muscle tissue. When collagen is fully synthesized, the legs will become more flexible. The calf, ankle, and foot will effectively bear loads and reduce the risk of recurring pain. Additionally, vitamin C helps increase the absorption of iron from food, supports the production of red blood cells, and improves oxygen circulation to the calf muscles. When oxygen and nutrients are adequately supplied, leg muscles experience less fatigue, have better resistance, and simultaneously reduce the risk of cramps. The consequences of vitamin C deficiency are clearly manifested through symptoms such as muscle pain, easy bruising, weak limbs, arthritis, slow wound healing, bleeding gums, or osteoporosis. In the long term, a deficiency in vitamin C increases the risk of joint degeneration, pain, and reduced mobility in seniors. So how can we properly supplement vitamin C? First of all, you should eat plenty of fresh fruits and vegetables, rich in vitamin C, such as oranges, tangerines, strawberries, kiwis, papayas, bell peppers, tomatoes, broccoli, and kale. The recommended intake is 75 to 90 milligrams per day for adults, which can be increased to 100 to 200 milligrams per day for seniors. Note that vitamin C tablets should be used only when prescribed by a doctor to avoid misuse. Maximum dose 2,000 milligrams per day. And high doses should not be taken for extended periods to prevent the risk of kidney stones and digestive disorders. So vitamin C not only helps you prevent colds. For seniors, this is a silent weapon against degeneration, helping to maintain muscle mass, protect joints, increase mobility, and prevent troublesome nighttime cramps. Place vitamin C in the right spot in your daily meals, because healthy legs also start from simple nutrients like that. Let's talk about vitamin B12, which plays an extremely important role in maintaining neuromuscular function. This is a type of vitamin that participates in the production of myelin, the protective layer for nerve fibers, helping to increase the speed of signal transmission to the muscles. When lacking, B12 signals transmitted from the brain to the legs will be delayed easily, causing numbness, involuntary cramps, muscle weakness, or poor balance when walking. However, the worrying thing is that most seniors are very likely to be deficient in vitamin B12 without even realizing it. After the age of 60, the ability to absorb B12 decreases significantly because the stomach produces less acid and intrinsic factor. Additionally, many seniors tend to be vegetarian or reduce their meat and fish intake due to fear of increasing cholesterol, leading to very low levels of B12 in their diet. Stomach and intestinal diseases, or the use of metformin and stomach medications, also quietly deplete vitamin B12 in the body. Medical studies have clearly shown a deficiency in vitamin B12 significantly reduces the mass and quality of bones and muscles, weakens leg strength, and increases the risk of paralysis, tremors, and loss of external sensation. Studies on seniors with B12 deficiency show that after just 3 months of supplementing 100 micrograms per day, muscle strength and mobility were significantly restored. In terms of mechanism, vitamin B12 helps synthesize myelin that wraps around nerve fibers, directly facilitating the transmission of signals from the brain to the leg muscles, smoothly and quickly reducing the risk of neuromuscular disorders, cramps, and numbness. B12 also participates in amino acid metabolism, increasing muscle protein synthesis, helping muscles recover faster after exercise or injury. More importantly, B12 helps reduce the concentration of homocysteine in the blood, a substance that, when accumulated excessively, can increase inflammation, nerve damage, and decrease muscle quality. The good news is that vitamin B12 can be safely and effectively supplemented even if you have poor absorption. Seniors can take it in the form of tablets, sublingual lozenges, nasal sprays, or intramuscular injections. A dose of 500-1,000 mcg day has been shown to be as effective as an intramuscular injection in seniors with poor absorption. Foods rich in B12 include red meat, liver, eggs, milk, cheese, and fortified cereals. To accurately determine the deficiency level, you should have regular blood tests, B12, homocysteine, and MMA, and consult with a doctor. Vitamin B12 is the silent protector of leg strength. A deficiency in B12 not only causes muscle weakness and cramps, but can also lead to irreversible nerve damage if prolonged. Proper and regular supplementation of vitamin B12 combined with a diet rich in animal protein and regular monitoring of tests, is a scientific strategy that helps seniors achieve the goal of stable mobility, reduced numbness, and freedom in daily life. Calcium seems to be very familiar to seniors, but many people only know it is related to bones without truly understanding the deeper role of calcium in muscles' neuromuscular function, and especially in preventing cramps for those over 60. Everyone thinks weak legs are due to age, but in reality, calcium deficiency could be the silent culprit causing you to walk unsteadily, experience muscle pain cramps, or suffer from nighttime leg cramps. The reasons why seniors are prone to calcium deficiency include many factors, from a calcium-poor diet due to fear of milk, little seafood, or green vegetables, to vitamin D deficiency reducing calcium absorption, aging of the digestive system, chronic diseases such as kidney failure, inflammatory bowel disease, or due to the effects of medication diuretics, corticosteroids. Studies have shown that low calcium levels in the blood are associated with a decrease in muscle mass and leg strength in seniors. Regular calcium supplementation benefits muscle mass, reduces fatigue, enhances post-exercise recovery, and significantly lowers the risk of cramps. Regarding the mechanism of action, calcium plays an important role in muscle contraction. When nerves send signals to the muscles, calcium is released in the muscle cells and acts as a bridge between the actin and myosin filaments, thereby facilitating muscle contraction. When calcium is deficient, the ability to contract muscles is disrupted, causing cramps, muscle tremors, and unexplained muscle fatigue. In addition, calcium also contributes to transmitting nerve signals to muscles while working together with magnesium and potassium to maintain electrolyte balance, preventing muscle contraction disorders. A calcium deficiency also weakens bones, causes osteoporosis, increases the risk of fractures, and affects mobility. The good news is calcium can be completely supplemented through a daily diet. Milk, cheese, canned fish with soft bones like sardines, green vegetables, especially kale, bok choy, tofu, soybeans, almonds, fortified grain products. To optimize calcium absorption, it is necessary to ensure a daily intake of vitamin D at least 800 IU, which can be obtained through sun exposure, eating fatty fish, or using fortified vitamins. Seniors should remember the recommended calcium intake is 1-200 mg a day for women who are 51 years and men 70 years. In case of insufficient dietary intake, you can divide the calcium dose into 2 to 3 times a day to improve absorption. Avoid taking calcium at the same time as iron, zinc, or magnesium to prevent absorption interference. Finally, don't forget to drink enough water when supplementing calcium, and it's especially important to get tested to measure calcium levels, check kidney function, and consult with a doctor before taking high doses. In conclusion, calcium not only helps strengthen bones, but also plays an essential role in muscle contraction, nerve signal transmission recovery after exercise, and preventing cramps. Don't wait until your legs are weak, your muscles are sore, or you experience cramps at night to think about calcium. Start boosting this mineral today to protect your strong legs and long-term independent life. Although magnesium is not as popular as calcium or vitamin D, its role in regulating muscle contraction, preventing cramps, and maintaining leg strength has been clearly proven by science. As we age, the body's ability to absorb magnesium through the intestines decreases while the demand increases due to losses in metabolism, physical activity, and recovery. Many seniors eat little green vegetables, seeds, and whole grains, foods rich in magnesium. Additionally, the use of diuretic stomach medications or certain antibiotics has been shown to increase magnesium excretion in urine, making seniors even more prone to deficiency. Contrary to common belief, cramps are not only related to a lack of calcium or potassium, but are also closely linked to a deficiency in magnesium. Magnesium is the mineral that helps muscles relax after contraction. When magnesium is deficient, muscle cells become overstimulated, leading to painful spasms and uncontrollable cramps, often occurring at night. Additionally, magnesium is key to evenly transmitting electrolytes throughout the body, while also participating in hundreds of enzymatic reactions related to energy metabolism for muscles. It can be said that a lack of magnesium means that muscles do not function efficiently, tire quickly, and do not recover after exercise. Clinical studies have shown that magnesium levels in the blood are closely related to muscle strength in seniors, particularly grip strength and ankle push strength. People with low magnesium levels often have weaker muscles, more pain, and are more prone to cramps. When you supplement with magnesium, what will your body do? Immediately after being absorbed through the intestines, magnesium enters the bloodstream and is transported to muscle tissues. Here, magnesium helps regulate muscle contraction and relaxation, protecting muscle cells from oxidative stress and inflammation. Thanks to stabilized electrolytes, signals from the nervous system to the muscles become more rhythmic and synchronized, helping you reduce muscle spasms and cramps. Additionally, magnesium also participates in the conversion of ATP, the energy currency of the body. Thanks to this, muscles will have more energy to move, maintain endurance, and recover faster after walking, climbing stairs, or exercising. How should you use magnesium to ensure healthy legs? Seniors should ensure they supplement 320-420 millimoles of magnesium daily through food or supplements. Dark leafy greens, nuts such as pumpkin seeds, almonds, lentils, quinoa yogurt, and salmon are all good natural sources of magnesium. If you can't get enough through your diet, consider taking magnesium citrate or glycinate, easily absorbed, less likely to cause digestive issues. Magnesium is not just an ordinary mineral. It is one of the most important keys to maintaining steady legs, flexible movements, and saying no to cramps. Make sure your body gets enough magnesium every day, starting with meals that include green vegetables on your plate. You don't need to give up all your daily habits to make a change, just the right amount to help your legs recover. Vitamin E is one of the prominent fat-soluble vitamins, known for its ability to protect cell membranes, reduce inflammation, and decrease muscle damage. However, many seniors in the U.S. do not realize that they are silently deficient in vitamin E. A monotonous diet low in vegetables, nuts, or vegetable oils, combined with the gradually decreasing absorption ability due to aging, results in insufficient vitamin E levels in the blood to protect the body. Especially in people with digestive issues, liver or gallbladder problems, or those who have had intestinal surgery, the risk of deficiency is even higher. So if you feel your legs are getting weaker, easily sore, After exercise or often cramping, that could be a signal that your body is crying out for vitamin E. Why does vitamin E have such a powerful effect on muscles and nerves? Because vitamin E is a powerful antioxidant capable of neutralizing free radicals, the molecules that attack muscle cell membranes during exercise or aging. When the muscle cell membrane is damaged, the muscles are prone to soreness, slow recovery, and loss of strength. Vitamin E helps the cell membrane self-repair, reduces inflammation, and protects the elastic structure of the muscle, thereby making you feel your legs are flexible, less sore, and less prone to abnormal cramps. Not only that, but vitamin E also participates in the process of protecting nerve fibers, especially the myelin sheath, the insulating layer for nerve fibers that transmit signals to muscles. When myelin is damaged due to aging or E deficiency, nerve reflexes slow down, causing muscle weakness, leg tremors, or numbness. Sensations very common in seniors. Properly supplementing with vitamin E will help restore neuromuscular conduction function, increase reflexes, and reduce the risk of falls, which is a top concern for seniors. However, to maximize the effectiveness of vitamin E, you need to pay attention to how you supplement it. Vitamin E is fat-soluble, so it needs to be consumed with foods that contain healthy fats, such as olive oil, avocados, and fatty fish for effective absorption. The recommended intake is about 15 micrograms a day, 22 IU, preferably from natural foods such as sunflower seeds, almonds, vegetable oils, dark leafy greens like spinach, avocados, salmon, and whole grains. If supplementation is necessary, it is advisable to take a dose of 100-400 IU day, as directed by a doctor, avoiding exceeding 1,000 mmHg a day to prevent the risk of bleeding, especially in individuals taking anticoagulant medications. By properly supplementing vitamin E from natural foods, pairing it with healthy fats, and getting regular checkups if needed, you are giving your feet the chance to recover, move steadily, and say goodbye to cramps, numbness, and pain. Start today, because each steady step is the foundation for an independent and fulfilling life after 60. Vitamin K2 is often rarely mentioned in conversations about the health of seniors. However, this is one of the most important vitamins that help keep the legs steady, reduce cramps, and prevent osteoporosis in old age. Vitamin K2 acts as an intermediary bridge between calcium bones and blood vessels. It activates proteins such as osteocalcin and matrix gly protein MGP, helping to transport calcium into the bones, preventing calcium from accumulating in the arteries or soft tissues. Thanks to this, bones are strengthened, the connection between muscles and bones becomes more solid, supporting movement and flexible walking in seniors. The special thing is that vitamin K2 helps regulate calcium metabolism in muscle cells, preventing excessive muscle contractions and reducing the risk of cramps, especially at night. When lacking K2, calcium can be left free in the blood, causing muscle stiffness, pain, and frequent cramps. This is why many people, despite supplementing with calcium and even vitamin D, still experience nighttime cramps. When entering the body, K2 does not automatically strengthen muscles, but it works through specialized proteins, helping to balance calcium for effective muscle contraction, preventing calcium overload during exercise or rest. It is particularly important to note that seniors often lack vitamin K2 due to consuming fewer fermented foods, being allergic to dairy, having digestive disorders, or using antibiotics and anticoagulants for extended periods. The good news is that vitamin K2 can be safely supplemented through fresh foods, natto cheese eggs, liver butter, or in the form of MK7 capsules, 180 mg day, which have been clinically proven to be safe and effective. It should be taken with a meal containing fat to increase absorption. To optimize effectiveness, it should be combined with vitamin D and calcium supplements. Properly supplementing with vitamin K2 is a sustainable strategy for seniors to maintain steady, independent, free, and safe steps every day. Potassium is often known as an important electrolyte, but few realize that it is a crucial factor behind the strength of the legs. In seniors, conditions such as muscle weakness, muscle fatigue, and frequent nighttime cramps often occur, and one of the most common causes is potassium deficiency. Potassium helps maintain the cell membrane potential, supports the transmission of nerve impulses to muscles, and regulates the contraction and relaxation of muscles in a coordinated manner. When potassium is deficient, the conduction becomes disrupted, causing the muscles to easily cramp suddenly. That is the biological mechanism of a cramp. In addition to regulating nerve impulses, potassium also helps maintain fluid balance, prevent cellular dehydration in muscles, and reduce the risk of muscle fatigue and soreness after exercise. At the same time, potassium participates in the conversion of glucose into energy for the muscles, increases endurance, and helps with quick recovery after exercise or injury. In summary, potassium is not just an ordinary mineral. It is an important electrolyte that helps maintain the harmony between nerves and muscles, reduces the risk of cramps, and increases leg endurance. Night cramps, muscle weakness, and pain are common issues among seniors, but few know that a deficiency in vitamin B6 is the silent culprit behind them. Even if you are taking vitamins every day, if they are not the right type or lack B6, the symptoms in your legs may still persist. Vitamin B6 pyridoxine plays an essential role in converting protein into energy nerve muscle transmission and stabilizing muscle contraction and relaxation activities. When deficient in B6, due to a monotonous diet, poor absorption, or long-term medication use, the body is prone to neurological transmission disorders causing cramps, numbness, muscle weakness, and tremors in the limbs. Studies show that supplementing with B6 about 30 mg per day in the B-complex vitamin group significantly reduces the frequency and severity of nighttime cramps in seniors. This occurs because B6 is converted into its active form PLP, a coenzyme that participates in over 100 enzymatic reactions, including muscle protein synthesis, neurotransmission, and the conversion of glycogen into energy. If you have a prolonged deficiency of B6, you not only experience muscle weakness, but also face the risk of irreversible nerve damage. Therefore, people over 51 years old should consume 1.5 to 1.7 hours of B6 daily from foods such as chicken, salmon, bananas, potatoes, eggs, chickpeas, and green vegetables. When necessary, supplements can be taken as prescribed. And don't forget, B6 works best when paired with B12 and folate, the trio that protects nerves and provides strong, stable support. Omega-3 is commonly known for its benefits for heart health and memory, but for seniors, it is also a key nutrient that helps increase leg muscle strength, prevent cramps, and support recovery after exercise. Omega-3 deficiency is common in seniors due to low consumption of fatty fish, poor absorption, or lack of fish oil supplementation, leading to increased inflammation, muscle weakness, and reduced mobility. Studies show that supplementing with omega-3 at a dose of 2 grams a day can increase muscle protein synthesis, reduce soreness, and improve walking speed. EPA and DHA, the two main components of omega-3, integrate into muscle membranes, helping to reduce muscle breakdown and chronic inflammation. Not only that, omega-3 also helps stabilize neuromuscular transmission, reduces the risk of spasms and cramps, and enhances mitochondrial function, generating more energy for muscles, improving endurance, and speeding up recovery after exercise. Seniors should supplement with about 500 millimeter 2 g of EPA DHA daily from foods such as salmon, mackerel, flax seeds, walnuts, or high-quality fish oil and algae oil. Taking it with a meal that contains fat helps increase absorption. Therefore, omega-3 not only protects the heart, but also serves as a powerful ally for the legs. Starting with a portion of fatty fish in today's meal can make a big difference for future independence and mobility strength. Here are 10 important vitamins for the health of your feet. Note that you might be taking vitamins every day, but if you don't understand the role of each type, the result will still be weak legs, easy fatigue, and prolonged nighttime cramps. The important thing is not just taking vitamins, but taking the right type, the right dose, the right way, and understanding the scientific mechanism behind each nutrient. There is no one-size-fits-all vitamin. Therefore, it is important to properly combine vitamins and mineral supplement through natural foods, maintain a diverse diet, and if necessary, consult a doctor to supplement correctly, avoiding unnecessary excess or deficiency. If you find this content useful, please subscribe to the channel, and turn on the notification bell so you don't miss the latest updates on senior health. And don't hesitate to leave a comment, because who knows, your question might help hundreds of others have healthier legs.